first of all, the original process, please correct me if I'm wrong, but the original MRT process that happened in 2011 started with an executive order that impaneled, so to speak, the MRT, and then was given specific instructions so that by March 1st of that year, there would be recommendations so the legislature would have a month to consider this before being implemented in the budget. Is that correct? That's correct. Okay. It is now January 29th. Let's just make sure that we check that date. Has there been an executive order issued by the governor to impanel the MRT?
Not yet. We are working on that.
Gotcha. Could you tell me, outside of the aid to localities budget, which is an 818-page document, that refers to the Department of Health, outside, is there any direct reference to the MRT in the actual budget language?
I have to check that.
It's a trick question, but I'll let you answer it anyway.
I believe there's reference in the book. I don't know if there is in the financial plan specifically.
Microphone a little bit closer, please. I can't hear you.
Yeah, I'm sorry. Good morning, Senator.
Good morning.
I believe there's reference to it in the budget documents. I don't know that there is reference in the financial plan. But I think that we've been certainly at the department for many months very clear that the successful results we had from the convening of the first MRT back in 2011, which saved taxpayers, tens of billions of dollars.
Since I have some limited time, I will say for the record, the first MRT might not have been perfect, but it achieved great things. So let's not talk about that one anymore. Let's talk about the one that we're supposedly putting together now. Outside, and I said it's a trick question because outside of references in like 15 different pages, there's a particular language that does not refer at all to an MRT. What it does, in other words, a Medicaid redesign team. There's no actual mention of a Medicaid redesign team. As opposed to that, there is language, I'm going to read some of it into the record. If on or, excuse me, before April 1st, 2020, the legislature fails to achieve $2.5 billion in aggregate savings from the appropriations enacted as part of any chapters of the laws of 2020, making appropriations for the aid to localities, et cetera, and then it goes on to uniform across-the-board reductions shall be applied to such appropriations to achieve $2.5 billion in aggregate savings. This is the question, the series, I wanted to make sure that we got to this point because what detail do we actually have? For the moment, there is the mention of the MRT. What is going to be who are going to be the members of the MRT? Could you tell us today, please?
At this point, we are working on that, and we will get that back to you quickly.
Okay. Again, January 29th, right? We're working on a timeline here. So,
but I will say that we are going to look at all, as they did when they did the first MRT, look at all the stakeholders who have an interest in this, will be represented, obviously, the legislature as well.
I was going to get to that.
And obviously the legislature as well. And we will work forward to address the changing landscape and make sure that there are any things that when the first MRT was put together,
but as of January 29th, we do not know who the members are going to be. That's number one. We don't know, right? Y'all might know, but we don't know. Number two, the powers that this MRT is going to have. There's no specificity of it here, right? Am I correct in that, or am I missing something?
We'll work all this out. This is the evolving process.
Third, the timeline. It seems to me that the timeline that's put here is completely unrealistic, particularly since it is now, again, January 29th, and we don't have any details. So this is because there's a couple of other things that I want to cover, and I want to make sure that I get some time, but this is the bottom line, and I just want to make sure that this is a publicly stated thing. We get it, that in the legislature we get it, that there is a crisis here, and that we have to work together to solve it. The best way to do that is to actually be on the same page. It is a little bit concerning, scratch that, a lot very concerning, that you are coming to a public hearing on January 29th, and you're telling us that by April 1st, we have to just accept something that's going to be put together by a magical crew of folks. We don't know who they are. We don't know the power that they have. The timeline that they have is either we accept it or according to this language, there's just an across-the-board cut. That is not acceptable. And I'm saying it both to you as representatives of the governor, and I'm saying it to the governor. It is not acceptable that this is what you're asking us to do. That's number one. Let's get to the second part.
Let me just respond about the timing issue. I mean,
please.
The department has risen to the occasion, and the entire administration on many issues, and even though you feel April 1st is right around the corner, we will rise to the occasion again and address all these issues and move it forward as quickly as possible and work quite diligently and quite hard and long hours to get that done.
Beautiful. Can I get a commitment that we will have, like in 2011, can we get a commitment that the legislature would have something to consider by March 1st of this year?
Well, I don't want to commit to a date or a time, but we can get back to you on that exactly.
So I will say again,
I understand.
it would be preferable that we have some time as a legislature to look at whatever solutions. And more importantly, as you referred earlier, that we have a role in determining what those policies are. We would love to be participating, and I know that many folks in this room, the stakeholders, since you talk about stakeholders here, but there's no clear line of who those stakeholders are, and there's many stakeholders that need to be part of that process. Moving on, let's talk about the to localities thing. There is a way that you are suggesting that localities across the state would be penalized if they don't meet certain criteria. So I just want to talk about that for a second. Do we have, there is the issue of the 2% and the 3%, right? That if a locality is underneath the 2% property tax cap, and then there's a 3% growth or less, that they would be able to recoup some of those savings that they've
stay
accrued to the
under,
state?
right.
Very well. Can you point to me language in the budget that actually lays out how a locality would do that, number one?
I'll go back and look at that.
Yeah, trick question again, ain't there, all right? It's not there. So you say that it is, but a press release does not reality make. So I need to know how the localities would do that. And more importantly, what data are you relying on that tells you there's 62 counties, right? 5 of them in the city of New York. So do you know, could you provide us with the data, because you haven't so far, but maybe you did today, I don't know. Then you provide us with the data that tells us what counties actually fall within the criteria that you established.
Well, we can get you that exactly which counties.
Again, thank you, I guess. Ma'am,
Well, thank you. I mean, I'd like to just, if I can, at this point,
Please.
talk a little bit about, in response to your question about what would you expect from localities. And there is in the financial plan a chart that shows by locality the amount of Medicaid spending that has been assumed by the state since the takeover of the growth. And I think you know those statistics, Senator, that it's that for a number of years, local contribution has been frozen, if you will, at $7.6 billion, with New York, with the state assuming about $4 billion a year in the additional growth of the Medicaid program since that point in time, cumulatively.
since I have 2 minutes, sorry to cut you off again, I'm just going to be, since localities use federal and state guidance on who is eligible, I'm not sure that they have any discretion to determine who's actually
Yeah.
on their rolls or not.
Yeah.
So how is it that they're going to be held responsible for
Right.
things that they don't necessarily have control over?
Yeah, so just maybe to level set here, locals make about 47% of the eligibility determinations. They're largely for people who are in need of long-term care, people who are eligible for Medicare and Medicaid, duly eligible, and other individuals such as people with excess income that spend down to Medicaid. And while for all of us, Medicaid eligibility is spelled out largely in federal and state law, day to day, we partner with the locals in applying those rules and those eligibility criteria. And really what these proposals are intended to do is to bring the districts and my folks within the Office of Health Insurance Programs to the table in partnership to find savings and efficiencies. The other
Gotcha. I got 1 minute left, so I'm going to cut you off. Just one last thing I'm going to say, just want to make sure that we're on the record about. So again, the MRT was a good thing overall. It managed to flatten cost curves, et cetera. The program kept existing. Can we all get on the same, can we all agree that the formula that was created 10 years ago is not operational anymore? If I'm not mistaken, if we look at the numbers, the cap has been pierced on basically every year for the last, 4 or 5 years. The question here is, do we need to revisit whether the cap is a good idea? And if it is, should we not revisit the formula so that we're not, because the reason that we're in where we are is that we set this artificial cap. Yes, it's statutory, but we can move it, and then we no longer find ourselves in a place where we have to cut everything that you've cut already, which, I'm going to come back with 5 minutes later So other folks are going to go at you, but just the last thing that I'll say, it is not acceptable that you're not bringing details to us that can help us make better decisions about what this budget is going to be. But I'm going to come back in a little bit.
Okay,